Long before modern medicine, people turned to nature for their healing. Herbs were their remedies, used in countless ways, brewed into teas, extracted for their oils, or even chewed raw. Each method had a purpose, tailored to treat various ailments. But now, when we look at the world of medicine, we see pills, liquids, and injections. What's interesting is that the same medication, with the same active ingredient, can be found in all three forms. For example, you might get sick, and the doctor prescribes an injection, but when your brother had the same illness, the doctor gave him a liquid or a tablet. So what's going on here? Is there a reason behind these different forms? Are doctors just fans of injections? Why aren't all medications the same? Welcome, I'm Rayan. But before we dive into today's topic, if you're new to the channel, don't forget to subscribe and hit the notification bell so you never miss out on our latest videos. Now, to understand why medications come in different forms, we need to take a journey back in time. Ancient civilizations like the Greeks and Egyptians relied heavily on herbs and plants for their medicine. They had various ways to prepare these remedies: grinding herbs, mixing them with oils to make ointments, or boiling them for teas to treat colds and digestive problems. This continued until around 1500 BC, when they started creating powdered mixtures with honey or fats, forming small balls they called catopotion. This was the origin of what we now know as tablets. Over time, these tablets evolved into the modern forms we use today. As tablets were becoming more popular, in 1853, Alexander Wood introduced the world to the first subcutaneous injection. Just like tablets, injections evolved, becoming more effective over time. Despite their effectiveness, tablets remained the most common form of medication, even with the advent of injections. So why are tablets so popular? The answer is simple: convenience. Tablets are easy to take, and they come in many forms, like capsules coated with gelatin to protect them from breaking down too soon. But there's a downside to tablets: how well your body absorbs them. Let's say you take an aspirin tablet. It goes to your stomach, where it starts to dissolve. But the stomach isn't the best place for absorption, so the dissolved aspirin moves to the small intestine, where it breaks down further and gets absorbed into the bloodstream. But here's the catch: before the medication can do its job, it has to pass through the liver, which filters out a large portion of it. This means you might not get the full effect of the medication. Plus, the way your body reacts to a tablet can vary. What works for one person might not work as well for another. If you've ever had to give medicine to a child, you know how challenging it can be. That's where liquid medication comes in, easier to swallow and often flavored to make it more appealing. Liquid medications also work faster because they don't need to break down in the stomach. However, they still have to go through the same digestive process as tablets, so some of the medicine is lost along the way. Now, if you need something fast-acting and potent, injections are the way to go. Unlike tablets and liquids, injections bypass the digestive system entirely, entering the bloodstream directly. This means the medication is absorbed at 100%, making it the most efficient form. This is why injections are often used for severe illnesses or when a quick response is needed. For example, insulin must be injected because it would be destroyed by stomach acids if taken orally. So, does this mean injections are always the best choice? Not necessarily. Let's look at three people with the same problem: a toothache. Lucas, who's 37, prefers tablets. Little John, who's just 1, can't swallow pills, so he takes liquid medication. And engineer Leo, who's 50 and just had surgery, needs an IV injection because he's not well enough to take anything orally. The medication is the same, paracetamol, but the form differs based on each person's condition. So the next time you're prescribed medication, remember that the form it comes in isn't random. It's carefully chosen to suit your specific needs. That's all for today. If you made it to the end, you're awesome. Give us a like so we know how many of you stuck around. Until next time, take care.